Okay.
Okay, so here we go. Okay, so we're on route, right? So route, what did that mean?
Like
How you take it, okay? So here, PO means orally, okay? It is a medical abbreviation, and so that means oral, okay? So we're gonna give Tylenol orally. And then the fourth component is the frequency. What does frequency mean?
Like how every 4 hours or 6 hours.
Yes, so here we have every 4 hours that we're gonna give Tylenol, okay? So frequency is how often you give it to your patient. So those are the 4 components of a medication order, okay? And so you're gonna need to know those for Quizlet later. Okay, so our next slide talks about medication administration. There we go. Okay, so yes. So how can the nurse know that the medication is safe? Again, remember I asked you the question, you just trust that the medication is the right amount, right? So a nurse cannot trust that a doctor knows exactly what they're ordering, all right? Because doctors can make mistakes. So it's the responsibility of a nurse or whoever's giving the medicine to look it up. Everybody has a drug handbook right on your desk, okay? So there are certain things that we can look up in a drug handbook, okay? It'll tell us the name of the medicine. It'll tell us the amount that is safe to give to patients. Tells us the routes, how it can be given. Some medicines can be given different ways. Tylenol, for example, can be given orally, or it can be given rectally in a suppository, okay? It'll tell us the side effects that a patient may experience. Also, nursing implications or considerations. I think that's the way it is in your book. And that just tells us what a nurse has to do before we can give the medicine. So some of the medicines, you have to take a blood pressure before you can give the medicine, okay? And then contraindications, that means when can we not give the medicine, okay? There are certain times that we can't give a medicine to somebody, okay? So I want you to look up the drug acetaminophen, and it's right there on the slide, okay? And so,
Looking up.
76. 76. Okay, so it says, yeah, it really starts on page 73, okay? So on page 73, that red box there, it says acetaminophen, okay? And so let's turn the page. I want you to tell me the uses or the indications. Why would we give it to a patient? It's on the next page. Pain or fever, mild pain or fever, is that the only indication? Moderate pain. Okay, so really just pain and fever, right?
Wait, isn't there another one? It's like,
What?
it helps like different types of, like on the bottom now, just to prevent like adverse reactions, like children that have.
Yes, very good. Prevention of adverse reactions in children at high risk for seizures, okay? So we have, those are 3 different uses or indications. That's why a patient would get a medication. You've taken Tylenol before, right? Why? Because you have a headache or maybe you have a fever, okay? Those are the main reasons, all right? So tell me how it can be given. What are the routes? Oral, rectal, liquid form for children. That's it, right? So orally, rectally, and through the IV, right? In that red box, what does it have there? IV? Okay. What are some side effects? Raise your hand and give me a side effect. Or adverse reaction. Yes, sir.
Agitation,
Agitation,
anxiety,
headache, nausea and vomiting, anxiety,
Hypertension,
okay,
constipation.
constipation. All right, good. So those are side effects. Now, does that mean that everybody, when you took Tylenol, did you get all those?
No.
No. That's just something that could happen to a patient. So patients need to be aware of that. Have you ever seen a commercial about a medication? And they list so many things, right? Me and my son listen to them and we laugh because it's like, really? Some of them are death. It's like, oh, I don't want to take that, right? But a patient needs to know what the side effects are so they can make the choice whether or not they want to take that medicine, okay? And then nursing implications and contraindications, we talked about those, and we'll look them up in a minute, okay? I'm gonna have you fill out a sheet later. Okay, 6 rights. The 6 rights of medication administration. This is how we can remember how to make sure that we're doing it safely, okay? So there are 6 things that we need to check. The first is the right patient. Do I wanna give your medicine to her? No, because it could harm her, okay? She might be allergic to it. So I have to make sure that we have the right patient. So the way that I do that is, before I give it to the patient, I'm gonna ask them to tell me their name. So I'm gonna say, good morning, okay? Remember, do patients in the hospital feel very good?
No.
Probably not. So do you wanna go like, hey, here's your medicine? No, you say, good morning, you know what, can you give me your name? Do you want them to tell you their name? You don't wanna say, hi, Miss Samantha, can you tell me your name? Cause you already told her what her name was. If she was confused, she'd say, well, you said my name was Samantha, so it's Samantha, right? You want to ask them to give their name, okay? So you say, good morning, can you tell me your name, please? And then you check to make sure that it's the right patient on the ID band and from what she says to you, okay? Then we have, you also need to check their date of birth, okay, on the ID band. Because there's a lot of Maria Garzas here in the valley, okay? There's like maybe hundreds of them, okay? With the same name. So how do we know which one is which? We look at the birth date, okay? Well, then there's another problem, okay? So then we look for something else, okay? So then we have the right drug. That's the second right. That means, are we giving the right medication? Is it the right medication? There are 3 checks that we have to do. We check it when we get the medicine bottle. Let's say you're at home, you get the medicine bottle, and what do? You check. Oh, this is Tylenol. Yes, this is what I want. Then when you open the bottle and you pour out your pills, yeah, that was Tylenol. You close it before you put it back. That's your 3rd check. You say, yeah, it was Tylenol. You gotta make sure that you're giving the right medicine. You don't wanna give the wrong one, okay? So those are your 3 checks. So you read it and you compare it to the order that the doctor wrote before you give it to your patient. The 3rd right is a right dose, okay? That means that you're giving the right amount for your patient, okay? So if the doctor says, I want you to give 2 milligrams to your patient, but the bottle of pills says that each pill is only 1 milligram, how many pills would you give? 2. So that's making sure that you're giving the right dose, okay? So if the order does not match the label, you have to make a little calculation. And that was a very simple calculation, right? You knew that you gotta give 2 pills. So we may have to do a little calculation before we give medicine here. The 4th right is a right route, okay? What did we say a route was? The way you give it. Is it orally? You don't wanna give a rectal medicine through the mouth, okay? Because it wouldn't be absorbed properly. It would not be distributed throughout the body properly, okay? So we have to make sure that it's the right route. The right time is the 5th right, so we gotta make sure that we're giving it at the right time. If the doctor says every morning, can we give it at night? No, okay? So we gotta make sure it's the right time. And then right documentation. So after you give your medicine, you have to make sure that you write down exactly what you did. So I would say, what's your name? Susie. So Susie would write, okay, I gave patient Samantha Rios Tylenol, 500 milligrams, and she swallowed it well, she had fever, whatever, okay? So you have to really, make sure you have the right documentation, okay? Okay, so remember I told you about a label. So that's how you know what medicine is in the bottle, right? There are 3 parts that you have to look for. The first is the name of the drug, okay? So what's the name on this label? Ibuprofen, okay? The second part is the dose. So in each tablet, how much is there? 200 milligrams, very good. Okay, and then we want to know the form of the drug. So what is the form? It's a coated tablet, very good. So we know that in this bottle, there's ibuprofen, and each coated tablet has how many milligrams? 200 milligrams, very good. Those are the 3 parts that we have to look at, okay? Again, we don't want to give a tablet that somebody drinks and put it somewhere else, right? Okay. So we kind of went over this already, how to calculate, okay? So here's an example here. We have, this would be the doctor's order, okay? The doctor tells you, you want to give acetaminophen 1,000 milligrams PL every 6 hours. So here's your label on the bottle. What does the label say? Is it the right medicine?
No, wait.
Yes.
Acetaminophen, okay? What's this dose that he wants us to give? 1,000 milligrams. But how much is in each pill? 500. So that doesn't match, right? So we're gonna have to do a little calculation. So the way we remember is D over H. That means dose desired, or the doctor's order, D, doctor, okay? Over H, which is the dose on hand, or what you have with you, okay? So what is the doctor's order? 1,000 milligrams, and what do we have? 500. So this is how we set it up. D over H, we would put 1,000 milligrams over 500, and what does that equal? 2. So we know that we're gonna give 2 tablets, okay? So that's how we do simple calculations, okay? All right, so you guys have a sheet that tells you step by step what to do. So in a little while, when we come and give medicines to our patients, I want you to bring that sheet up with you, and we're gonna have one person read it, and the other person is going to do the steps, okay? So we have to go in, we have to make sure that we read the order, that we have the right medicine, okay? We're gonna check the medicine 3 times, right? We're gonna check that bottle 3 times, gotta make sure, triple check. We're gonna wash our hands, we're gonna check the expiration date, and then we're gonna pour out the proper amount of pills, okay? Maybe 1, maybe 2, you could give half, okay? So we gotta make sure that we do the right calculation. We're gonna greet our patient. How do we greet our patient?
Good morning.
Good morning. Very good. Good morning. My name is Adrian. I'm gonna be giving you your medication today. Can you tell me your name and your date of birth? And so they're telling you, and you have to check it on the ID bed, right? Okay. And then you're going to tell your patient what they're gonna be getting. Okay? Maybe they're getting Tylenol. So you're gonna tell them, I'm gonna give you Tylenol, and you're gonna tell me why they're getting it. Okay? So that's something that we're gonna look up in the book. You also wanna ask the allergies. You're gonna help your patient sit up. How many of you have tried eating or drinking while you're laying down flat? Right? And you make a mess on the bed. Is it very comfortable? No. Okay? So we wanna make sure that our patient is in what position? Sitting up, okay? So that they can swallow easily. So we're gonna help them to sit up. We're gonna give them education. So what does that mean? What are we gonna tell them?
Like how to use it.
How to take it, okay? We can tell them the dose. Huh?
Like how, like every day.
How often they are gonna take it, yes. The side effects, very good. We gotta try to tell them about the side effects so they know what to expect.
What about the ones that are supposed to like be in the fridge?
Okay, so that would be, instead of getting the medicine from a cabinet, we would get them from the refrigerator. That's fine. So there's different ways that we can store medicine, very good. Okay, we can store it in a cabinet, we can store it in the refrigerator, okay? We're gonna give